not everybody gets it, but some of these medications can cause nausea. So usually happens again the first couple of weeks, and then it's just kind of your body gets used to it, so that it goes away. Some of the things you can do with the nausea is people can chew on the sugarless, like candies, for example. The other things you can do is sometimes if you take a medication with food, it helps you with nausea, but not every medication should be taken with food. So always talk to your pharmacist or your provider if medication is causing you nausea. Ask them, can I take it with food? And if they said yes, then you can take it with a small amount of food. You can spread out your food, like eat smaller portion of the food throughout the day. So that helps with the nausea. Because nausea is usually when you have a stomach, empty stomach, it causes that. Dry mouth is another one. Dry mouth you usually see with those tricyclic antidepressant, the old antidepressant. Again, the same thing. You want to like sip water, brush your teeth frequently. A lot of times, if people use tobacco and alcohol and take this medication, it causes a dry mouth to happen more frequently. So you can avoid alcohol and smoking if that is possible. You can chew on like a sugarless candy or sugarless gum. That helps with a dry mouth as well. Insomnia and trouble sleeping is the opposite of the drowsiness and fatigue. Those obviously in those medications, then you want to talk to your provider and ask them, is it okay if I take it during the day? So because then you can sleep at hopefully by nighttime you can eat enough and you can sleep. The other thing you can do with those is to avoid caffeinated medication at bedtime or near the bedtime. That helps to prevent you from going to bed. Constipation and that could happen with some of our medication, especially those the tricyclic antidepressant can cause constipation at the beginning. If you do experience that, recommendation is to drink a lot of fluid, a lot of water with it, take fiber, a lot of fiber products or fiber supplements if needed. And then weight problem, we talked earlier about it. Sometimes a lot of this medication is called fluid retention, so that's why you get that weight gain. Or also, you might be because one of the symptoms of depression is you have poor appetite. Now you're taking a medication that is helping you with those symptoms, so now your appetite is better and you want to eat. So that's probably why one of the reasons you can potentially gain weight with it. So again, talk to your provider. Not every medicine causes the weight gain. They can also help you with, again, diet and exercise and other nutritional intake to balance it off. And some of the newer antidepressants, the SSRI that we were talking about, they might cause sexual issues. And again, talk to your provider about that. If that's the issue, they can switch your medication around as well. Some of the serious side effects for antidepressants, some of the serious antidepressants, these are the ones that you actually want to worry a little bit about it. The first one is the suicidal thought. Those usually happens a lot with the younger children, adolescent and young adults. And again, with initiation of therapy, you see that suicidal thoughts. That's why usually when you start any kind of antidepressant, the provider doesn't give you a very large quantity of those medication. They're going to give you a smaller quantity. Plus, also they want to see if you tolerate it before they prescribe you a large quantity of that medication. Allergy reaction, obviously any of these medications potentially can cause you to have allergy. It's very seldom you see it, but it can happen. So keep an eye if you have a rash, hives. Obviously, if you feel like your chest is tight or your throat is closing up, those are like a serious allergy reaction that you want to get medical help immediately. But if you have a rash or something, call your provider, talk to them, see if they can decrease the dose or switch your medication around. Seizure, usually seizure happens if the patient have a history of a seizure or your people that are drinking alcohol along with some of these medications. Not every single one of these medications can predispose you to seizure, but some of them would be called, it decreases your threshold for seizure. So therefore, when you take it, that especially if you have a history of seizure, that can predispose you to have seizure. So it's very important as we talk more about some of the other medications to give a very good history of your condition and your diseases to your provider. So if you have a history of diabetes, seizure, hypertension, heart problem, the provider needs to know all of those because they can decide what medication to prescribe for you. Hyponatremia is a fancy word by saying that you have a low sodium level, and some of these medications can cause that. It can be serious if your sodium is really, really low, and that's why some of them, they check your blood so frequently to check to be sure that your sodium is not low.
Yeah, they had to keep me in the hospital because I was taking more medication that caused my sodium to drop.
Yeah, see, it can be serious, it can be very serious, but
Took me off of it.
yeah, and it doesn't happen, it's very rare, but it can be serious, so that's why it's very important to keep an eye and to check your blood frequently to be sure it's okay, and if it's really, really low, then that you can go to the hospital, and then they get you off of it. Serotonin syndrome is the one that we really, really worry about. That usually happens after a dose is increased or a patient actually overdosed on this medication, or after a second drug is introduced to your regimen. Some of the symptoms for serotonin symptoms are like agitation, restlessness, if you have abnormal eye movement, diarrhea, nausea, vomiting, fast heart rate or increased heart rate, your body temperature goes up, you lose up formation. If you have any of those symptoms, especially if you just started at a new medicine or increase your dose, then you may definitely have to call somebody because that's like emergency. They're going to be sure that you get seen. Some of the drug interaction with some of these antidepressants, they can any medication that can cause any of these medications might have a drug interaction. It's important to always tell your provider when you're starting on a new medication.